This first case articles on the Go feature is titled Orientation in Surgery: How to Be Successful, written by Melanie Perry, BSN, RN, CNOR. This article first appeared on The Circulating Life. I will never forget my first day on orientation in surgery. Total information overload. I had a deer-in-the-headlights look that everyone could see from a mile away. I watched a surgeon do a knee scope, and I remember thinking, what have I gotten myself into? My anxiety level was sky high. I'm pretty sure I questioned all of my career choices at that one moment. But it got better. The first case was scary, but every case after that built a little bit more confidence, and I learned a little bit each time. It wasn't long until I was off orientation and running rooms on my own. Although my first case on my own didn't go so great, but we all start somewhere. Sometimes other nurses forget they were new once, too. The other day, I overheard an experienced nurse, someone who had been in the OR for less than 2 years, being very hateful and criticizing a new OR nurse. But the complaints that this nurse had were all things that were part of the orientation process. Someone has to teach you before you know these things. I stepped in and defended the new person. What's considered common sense in the operating room isn't so common if you've never been taught it. So today I want to try to help you out a little bit, provide a few helpful insights, and hopefully we'll cover some things that others think are common sense so you're well prepared and set up for success. Number 1. Don't touch anything blue. That's the sterile field. Don't contaminate it. If you've been in the OR for even 20 minutes, you already know this. It's the first thing everyone tells you, but it's also good information to have ahead of time. So if you've gotten a job in the OR but you haven't started yet, please remember this. Number 2, when in doubt, throw it out. This is a common rhyme used to remind everyone that if you think it's contaminated or you're not 100% sure that it's sterile, toss it and get a new one. It's always best to know for certain that the instruments and supplies that you're using are sterile. You don't want to risk your patient's safety. Number 3, learn the meaning of surgical conscience. According to OR Today, surgical conscience is about much more than just using good surgical technique or not taking shortcuts. It's about consistently exhibiting ethical behavior and promoting patient safety all the time, in every circumstance, and doing the right thing in a surgical setting, even if nobody else is watching or is aware that patient safety has been compromised, however minor or insignificant the compromise may appear to be. This is so important. Learn from the beginning that we do the right thing, every time, regardless of who's watching. So if you contaminate a back table that's already set up, own up to it. Everyone might be angry because of all the work and expense involved in a new setup, but not speaking up is unacceptable. Number 4, keep a notebook. I say this all the time, but it's a necessity. Reference cards are great, but let's be honest, they're not always right. Especially in rooms where the same nurse and scrub always work together. One day the nurse is sick and the nurse who has to fill in is blindsided by the fact that the pref card hasn't been updated in 10 years. It's no fun for anyone, so take notes. That way, the next time you work with that surgeon, you'll look like a pro because you remembered exactly how he liked his prep stand set up. Number 5, show up to work on time. Don't come strolling into the OR at the last possible minute before you're considered tardy. Chances are the nurse you're working with that day has already been at work for 30 minutes, if not longer. Find out what time the nurse usually gets there and try to beat them to work. That way you can see all of the tasks that go into getting started for the day. You miss out on so much if you're not there from the very beginning. Number 6, pay attention to your room's atmosphere. Does the surgeon like loud music and lots of conversation? Or is it so quiet you can hear a pin drop? Chances are, if it's an OR that's painfully quiet, the surgeon doesn't want to overhear you talking about your weekend plans. If you notice that you're the only one talking, or the only one who isn't whispering, act accordingly or shut up. It will save you from the embarrassing moment when the surgeon's had enough and you get corrected from the field. Number 7, wear supportive shoes. Don't come to work in Crocs, and don't try to hide the fact that you're wearing sandals under your shoe covers. Find a good, supportive shoe that will be as comfortable in 8 or 12 hours as it is in the morning. I see lots of nurses in Danskos, but just as many, if not more, wear a comfortable tennis shoe. Number 8, stay off your cell phone. I say this all the time. You can't take care of your patient if you're on your phone. You also can't learn what you're supposed to be doing in a room if you're on your phone while the nurse you're working with does everything. I've seen this so many times. It makes the experienced nurse angry and makes the new nurse look really bad. So please, put your phone away during cases. It's best for patient safety and best for your orientation experience. Number 9. If you have questions, ask. I see this all the time too. Orientees don't understand something, but they won't just ask what's going on. You don't know everything yet. Questions are expected. But if you don't feel comfortable asking the nurse you're assigned to, seek out a team leader, manager, or nurse educator. Number 10. Expect some OR humor. No matter how demanding someone is, do not run out of the room to get them a sterile set of fallopian tubes. I promise, the only one stressed out about them will be you when you can't find them. These kinds of jokes don't happen everywhere, but I've heard stories of other nurses' experiences during orientation. And if someone does have a little fun, remember that the OR is full of people with a weird sense of humor. Hopefully this list will help you out. There's plenty more that you have to learn, but if you take into practice these 10 things, you'll be starting out set up for success. Remember, you can do this. As always, thanks for listening to this episode of First Case Articles on the Go.